Okay, in this video, we will be discussing about thrombocytopenia, its etiological classification, okay, and then its approach. So, let us start with thrombocytopenia. What is thrombocytopenia? Platelet count less than 1.5 lakh per microliter is thrombocytopenia. What are the different etiologies of thrombocytopenia? It can be decreased production, it can be increased destruction. Decreased production can be seen when bone marrow is hypocellular, when bone marrow is hypercellular, or when there is marrow replacement by some other components of blood. So hypocellular bone marrow, the most common and most famous cause is aplastic anemia. Hypoplastic MDS, MDS can be hyperplastic also, but especially hypoplastic MDS we are talking about, obviously, because we are talking about hypocellular bone marrow. Third cause is drugs. In case of hypercellular bone marrow, we can see myelodysplastic syndrome, which is hyperplastic, leukemia, megaloblastic anemia, and sometimes there is replacement of bone marrow by some other neoplastic cells. For example, we see in primary myelofibrosis, or we see in DLBCL, or we see in follicular lymphoma. So, in those cases, the marrow is replaced by fibroblasts, or marrow is replaced by excessive collagen deposition, excessive reticulin deposition. Those disorders are called as myelophthisis. Obviously, there will be decreased platelet production and resulting in thrombocytopenia. Increased destruction is mostly autoimmune. If the autoimmune cause is idiopathic, no associated condition, it is called as primary ITP. If there is some associated condition like connective tissue disorders or some drugs or some infections like HIV, this is known as secondary ITP. And there can be non-immune causes also, which are known as thrombotic microangiopathy, TMA. Right? There are some other causes which are not classified otherwise, like abnormal distribution, splenic sequestration, dilutional hypothermia. EVAN syndrome, which is a combination of ITP and autoimmune hemolytic anemia, in which there is direct Coombs test positive. And sometimes we do not know the mechanism. The etiologies are ehrlichiosis and babesiosis. They will all cause thrombocytopenia. Now, suppose a patient comes to you with thrombocytopenia, how will you approach the patient? First of all, see if the clumps are present. If clumps are present, repeat the sample. If no clumps are present, means it is true thrombocytopenia. If true thrombocytopenia, see if along with thrombocytopenia, peripheral blood film is normal or abnormal. If it is normal, means there is some autoimmune cause may be there, right? If there is normal PBF and thrombocytopenia and only thrombocytopenia, no other cell is affected, it means it is ITP, right? Remember, in ITP, PBF is normal. ITP is primary if there is no associated condition found, and it is secondary if there is culprit identified. Culprit can be, like we just studied, culprit can be infections like HIV, drugs, or some other conditions like connective tissue disorders. Thrombocytopenia, if associated with abnormal blood PBF, abnormal cell findings. Now, the cells that we see in PBF can be spherocytes. We can find schistocytes. We can find pancytopenia, or we can find blasts. Right? Let me make the picture a bit big. If we find the spherocytes, it is hypersplenism or EVAN syndrome. If we find cystocytes, of course it is hallmark of thrombotic microangiopathy or microangiopathic hemolytic anemia. If we find blasts or we find pancytopenia along with thrombocytopenia, then leukemia or myelodysplastic syndrome is suspected. If we see leukoerythroblasts, means there are leukocytes also, there are erythrocytes also, and both in blast form, then it is myelophysis, right? There is an attempt to generate more and more RBCs and WBCs, and their before time release into the peripheral blood causes leukoerythroblastosis. It is seen in myelophysis. So that is how you approach thrombocytopenia. So that is all about thrombocytopenia. It is just an overview. Of course, when we look into the individual etiologies, for example, aplastic anemia, hyperplastic MDS, ITP, and like megaloblastic anemia, leukemia, etc., ITP, autoimmune hemolytic anemia, we will be more clear with the with this entity of thrombocytopenia. So this was overall about this video. Thank you very much for your patient listening.